Ma'am. So please give us a short introduction about you, ma'am.
Thank you, ma'am. Hello, everyone. I am Dr. Kritika. I have completed my MBBS, Diploma in Dermatology, and MD in Dermatology. And currently, I'm working as a consultant dermatologist in Karigiri Hospital at Vellore.
That's nice, ma'am. So let us get into the topic with fungal infections.
Yes, because of late, we are seeing many cases of fungal infection, and there is a lot of misconception regarding that. So I think that is a very important topic as a dermatologist and even for the general public to be aware about the fungal infection as such. So we will discuss about that first. Currently in India, we are facing an epidemic-like situation, like how coronavirus caused a pandemic. In our country and other tropical countries, this fungal infection is increasing day by day. And there's a lot of misconception around it, that people think it's just a skin infection, that it doesn't need much treatment, and they take treatment from local medical shops and all that, so which is resulting in this chronic nature of the disease. So there is a lot. What I see in many of the patients is that they think that it is first because food related, or they assume that it is because of some insect bite, or some even think that it is some kind of an allergy. So they need to understand that a fungal infection is transmissible. That is, it is communicable from one person to the other. So close contact with the person, sharing of personal items like towels, soaps, clothes, and bed sheets. So all those are the ways through which one acquires fungal infection. So if they realize the mode of transmission is through close contact and personal sharing of items, then they can avoid the transmission. So supposing a person gets, the other family members should be aware that this person is having it, and they should make sure that they use their items separately. So they need to first understand the transmissible nature of the disease. And apart from that, once initially, if they have any rash, because commonly fungal infection, it is common in our country because of the humid climate. So whenever there is more sweating and there is accumulation of sweating, especially in the groin regions, in the underarm regions, in obese patients, so these are the common sites where the fungal infection occurs. So patients should identify that if they have a rash in these areas, then it is probably or most likely to be a fungal infection, and they should start treatment as early as possible by consulting a dermatologist or a skin specialist nearby. And what many patients fail to do is, they think that it is a common rash, it is some kind of an allergic rash. So they straight away go to the medical shop, get some ointment for the time being, and they use it. But the thing is, majority of these shops give them a steroid medicines, just topical steroid creams. So that may at first initially reduce the symptoms of itching and the inflammation of the disease. But in the long term, what happens is it reduces the immunity in that local area, and the patient actually ends up having a widespread fungal infection later on within a few days. Okay. So this topical steroid abuse, that's what we dermatologists refer to as, has been very rampant in our country. So this is mainly because patients fail to consult a doctor at the initial stage. They first try all these medicines and home therapies, or try these creams from the medical shops, or visit some quacks and who prescribe steroids. And they finally end up coming to us in a very late stage, where either they're having a widespread infection, or at the time they are already developed side effects of topical steroid use. Like we get stretch marks, right? There are, if you use topical steroids for a long time, you get these really big stretch marks, which are permanent, which cannot be treated. So I'm seeing many young females in this, especially in this, 25 years, 19 to 25 years, who are applying these steroid creams in their thighs, in their groin region. They're coming up, they're presenting to us with wide and big striae, and then they're asking us for treatment for that. So at that stage, it becomes very difficult to treat. Yes. Once the fungal infection is also increasing on one side, it's spreading throughout the body, and the patient is also suffering from the side effects of topical steroids. So that is one point which I wanted to emphasize, that it is a very treatable disease. It is just a cutaneous infection which is caused by a fungus. So timely treatment, appropriate treatment will definitely result in the complete resolution of the disease. So, but patient has to follow certain general measures, like they have to take bath twice daily, use their personal belongings separately. They should not wash their clothes together with their other family members because it may spread. And they have to adhere to treatment. So consistency in treatment is very important. At least 1 to 2 months of treatment is required in most cases, both topical creams as well as tablets that the dermatologist will assess and then we will prescribe. So they have to be consistent with the treatment. If they take it for just 10 days and then stop it, there will definitely be a recurrence. Because the course is at least for a month to 1.5 months they should take, 1 to 6 weeks at least, 1 month to 6 weeks, and they have to apply the cream twice daily.
Okay.
We see many patients who we prescribe for a month or 2 months, but then they take it for just 10 days. And after 10 days, probably the disease comes down. They feel that they are cured and they stop the treatment.
Okay.
And then later on, they end up with the recurrence of the disease.
Okay.
And this has actually affected many patients psychologically. So till now, I have seen 5 patients who have had suicidal ideation because of they're suffering from extensive fungal infection for many years.
Okay.
4 or 5 years, patients are having this. But the truth is, it's a very treatable condition, curable condition. If they are just taking the appropriate treatment for the advised period of time, it is completely curable. So because the itching is more and because it is visible on the skin as a rash, patients are getting psychologically affected. They are not able to perform their work in their workplace. It's affecting their personal life as such. So what seems to be actually a simple skin disease turns out to affect the patient's quality of life much. So if the patients take appropriate steps and get it treated properly, they will definitely be cured of the disease, and this will also improve their life. And also, if they understand it is a communicable disease, they can take adequate precautions so that they do not spread it to the other family members and their friends.
That's very useful to hear this, ma'am. You have said all about the onset of symptoms and the course of the disease and what are all the measures to be taken to avoid transmission and all. So it's much helpful, ma'am.
Thank you.